Aloha, my name is Sage. I'm a licensed acupuncturist and I'm here at Hawaii Natural Therapy to show you a little bit about the ancient healing technique of Gua Sha. So I have here a Gua Sha tool. This is a traditional one made out of jade. Some people even use a rounded edge of a plastic spoon or even a coin if it's a very small space. Whatever you're using, it needs to have a nice rounded, kind of a soft edge, but it also needs to be able to create a scraping feeling. So what we do with Gua Sha is we just scrape lightly over the skin, and I'm just gonna start off here a little bit. We just scrape lightly over the skin. I'm not pushing very hard. I'm just going repeatedly over the area. And what eventually starts to happen is you have something called a petechie, or in Chinese medicine we call it the sha, start to appear. And that's gonna look kind of like a redness. What it is the broken blood vessels that are stagnant, that are not moving around anymore. They rise to the surface and are able to be reabsorbed by the body. So the more sha, the more of that petechie you have in an area, the more stagnation you have in the area, and the more you'll benefit from the Gua Sha. There's a lot of research that's been done on Gua Sha recently. It's proven to be incredibly anti-inflammatory, even though it's creating a superficial inflammation effect in the short term. In the long term, for the whole body, it can be incredibly anti-inflammatory due to the neurotransmitters that it causes to be released. So some things that are wonderful to treat with Gua Sha would be a stiff neck. And that would be a treatment like we're getting here, where you just can't move your neck. And so we would do this for a little bit, and then I would have John just turn your head, and then turn your head back, and then we would go a little further. Another thing that's wonderful to treat with Gua Sha is something like a frozen shoulder. So in that we would also treat the same area. We would also work under the arm, and we would combine that with movements and stretches as well. So you can see we're getting a little bit of the sha appearing right here, not a lot. John doesn't have too much stagnation, and most of it's not up here in the neck, but right up here in this upper muscle. And this could just come from, a lot of exercise and the buildup of the acid there, and that stagnating the blood a little bit. So with this, we'll have everything moving around, and probably he'll feel the most amount of benefit the next day. Okay, thank you so much. Have a wonderful day.